Ranitidine blocks histamine H2 receptors and decreases gastric acid secretion. Q872. Which drug is commonly used in migraine prophylaxis? A. Propanolol. B. Salbutamol. C. Adrenaline. D. Propanolol reduces frequency of migraine attacks by beta blockade. Q873. Which drug is used for opioid dependence treatment? A. Methadone. B. Diazepam. C. Aspirin. D. Digoxin. Ans. Methadone. Methadone is a long-acting opioid used in opioid substitution therapy. Q874. Which drug is used in constipation as a bulk laxative? A. Psyllium. B. Lactulose. C. Senna. D. Bisacodyl. Ans. Psyllium absorbs water and increases stool bulk. Q875. Which drug is a carbonic anhydrase inhibitor? A. Acetazolamide. B. Furosemide. C. Mannitol. D. Spironolactone. Ans. Acetazolamide. Acetazolamide inhibits carbonic anhydrase enzyme and reduces bicarbonate reabsorption. Q876. Which drug is used in ventricular tachycardia? A. Lidocaine. B. Omeprazole. C. Aspirin. D. Cetirizine. Ans. Lidocaine suppresses abnormal ventricular electrical activity. Q877. Which drug is commonly used in COPD management? A. Tiotropium. B. Atenolol. C. Digoxin. D. Metformin. Ans. Tiotropium is a long-acting anticholinergic bronchodilator. Q878. Which drug is used in anaphylaxis to improve blood pressure? A. Adrenaline. B. Propanolol. C. Verapamil. D. Aspirin. Ans. Adrenaline stimulates alpha receptors causing vasoconstriction and increased blood pressure. Q879. Which drug is a broad-spectrum penicillin? A. Amoxicillin. B. Ciprofloxacin. C. Doxycycline. D. Azithromycin. Ans. Amoxicillin inhibits bacterial cell wall synthesis and acts against many bacteria. Q880. Which drug is used in tuberculosis causing orange discoloration of urine? A. Rifampicin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Ans. Rifampicin commonly causes orange-red discoloration of body fluids. Q881. Which drug is used as a sedative hypnotic? A. Phenobarbital. B. Aspirin. C. Metformin. D. Omeprazole. Ans. Phenobarbital depresses CNS activity and induces sleep. Q882. Which drug is commonly used for nausea during chemotherapy? A. Ondansetron. B. Lactulose. C. Digoxin. D. Aspirin. Ans. Ondansetron blocks serotonin receptors involved in vomiting reflex. Q883. Which drug is used in type 1 diabetes mellitus? A. Insulin. B. Metformin. C. Glibenclamide. D. Pioglitazone. Ans. Insulin replaces deficient endogenous insulin in type 1 diabetes. Q884. Which drug is used as an antifungal in candidiasis? A. Nystatin. B. Acyclovir. C. Ciprofloxacin. D. Doxycycline. Ans. Nystatin binds fungal cell membrane sterols causing leakage of cell contents. Q885. Which drug is used in severe pain management? A. Morphine. B. Paracetamol. C. Aspirin. D. Ibuprofen. Ans. Morphine acts on opioid receptors producing strong analgesic effect. Q886. Which drug is commonly used in anxiety disorder? A. Alprazolam. B. Digoxin. C. Aspirin. D. Omeprazole. Ans. Alprazolam enhances GABA-mediated CNS inhibition and reduces anxiety. Q887. Which drug is used in iron overdose poisoning? A. Deferoxamine. B. Naloxone. C. Atropine. D. Vitamin K. Ans. Deferoxamine chelates excess iron and promotes its excretion. Q888. Which drug is used as an antiprotozoal agent? A. Metronidazole. B. Penicillin. C. Ceftriaxone. D. Azithromycin. Ans. Metronidazole damages DNA of anaerobic organisms and protozoa. Q889. Which drug is used in hyperlipidemia? A. Rosuvastatin. B. Metformin. C. Omeprazole. D. Diazepam. Ans. Rosuvastatin inhibits HMG-CoA reductase and lowers cholesterol levels. Q890. Which drug is commonly used as an anthelmintic? A. Albendazole. B. Ciprofloxacin. C. Doxycycline. D. Fluconazole. Ans. Albendazole inhibits glucose uptake in parasitic worms leading to their death. Q891. Which drug is used in bronchial asthma as a leukotriene antagonist? A. Montelukast. B. Salbutamol. C. Thiophyllene adrenaline. Ans. Montelukast. Montelukast blocks leukotriene receptors and decreases airway inflammation. Q 892. Which drug is used for emergency control of seizures? A. Lorazepam. B. Aspirin. C. Digoxin D. Atenolol. Ans. Lorazepam. Lorazepam rapidly enhances GABA activity to stop seizures. Q 893. Which drug is commonly used as an antacid? A. Magnesium hydroxide. B. Omeprazole. C. Pantoprazole. D. Ranitidine. Ans. Magnesium hydroxide. Magnesium hydroxide neutralizes excess gastric acid in the stomach. Q 894. Which drug is used in bacterial meningitis as a third-generation cephalosporin? A. Sfotaximi. B. Penicillin. C. Doxycycline. D. Gentamicin. Ans. Sfotaximi. Sfotaximi penetrates CSF effectively and inhibits bacterial cell wall synthesis. Q 895. Which drug is used for motion sickness and vertigo? A. Meclizine. B. Aspirin. C. Metformin. D. Omeprazole. Ans. Meclizine. Meclizine blocks H1 receptors and reduces vestibular stimulation. Q 896. Which drug is commonly used in hypertension as a beta blocker? A. Metoprolol. B. Salbutamol. C. Dopamine. D. Adrenaline. Ans. Metoprolol. Metoprolol selectively blocks beta 1 receptors, reducing cardiac workload. Q 897. Which drug is used as a uricogenic agent in gout? A. Probenecid. B. Allopurinol. C. Ibuprofen. D. Aspirin. Ans. Probenecid. Probenecid increases uric acid excretion through the kidneys. Q 898. Which drug is commonly used as a topical antiviral agent? A. Acyclovir. B. Fluconazole. C. Metronidazole. D. Amoxicillin. Ans. Acyclovir. Acyclovir inhibits replication of herpes viruses. Q 899. Which drug is used in emergency cardiac arrest? Adrenaline. B. Atropine. C. Verapamil. D. Digoxin. Ans. Adrenaline. Adrenaline stimulates cardiac activity and improves coronary perfusion during resuscitation. Which drug is used for osteoporosis to increase calcium absorption? A. Vitamin D. B. Aspirin. C. Metformin. D. Diazepam. Ans. Vitamin D. Vitamin D enhances intestinal calcium absorption and supports bone mineralization. Q 721. Which method is used for tablet preparation? A. Direct compression. B. Wet granulation. C. Dry granulation. D. All of these. Ans. All of these. Q 722. Which excipient is used as diluent? A. Lactose. B. Talc. C. PEG. D. Gelatin. Ans. Lactose. Q 723. Which instrument is used to measure hardness of tablets? A. Monsanto tester. B. Friabilator. C. Dissolution apparatus. D. Autoclave. Ans. Monsanto tester. Q 724. Which dosage form is used for local skin action? A. Ointment. B. Injection. C. Tablet. D. Capsule. Ans. Ointment. Q 725. Which is used as preservative in injections? A. Benzyl alcohol. B. Talc. C. Lactose. D. PEG. Ans. Benzyl alcohol. Q 726. Which is used as isotonic agent? A. Sodium chloride. B. Talc. C. PEG. D. Lactose. Ans. Sodium chloride. Q 727. Which is used as buffering agent? A. Phosphate buffer. B. Talc. C. PEG. D. Lactose. Ans. Phosphate buffer. Q 728. Acacia. B. Alcohol. C. Talc. D. PEG. Ans. Acacia.